and the Wilaya of Matra. And the central market for vegetables and fruits resumes retail sales to consumers amid precautionary health measures. Those were the headlines, and now the news in detail. The Ministry of Finance issued a circular to government institutions that it must speed up the replacement of expatriate workers with Omani citizens in various job levels. The ministry issued circular number 14 to all government bodies related to the Omanization policy and the need to fill jobs with national talents. The circular stated that the institutions must urgently replace expatriates with Omanis in accordance with a specific timetable for different jobs that should be implemented as quickly as possible, including leadership and supervisory positions. The ministry added that the executive position should be presented within the budget estimates for the year 2021 by next July. The Ministry of Health announced 143 new confirmed cases of COVID-19, which brings the total number registered in the Sultanate to 2,274, including 10 deaths. The Ministry of Health stresses that 364 cases have been recovered.
Within the efforts to limit the spread of COVID-19, the ministry advises all citizens and residents to keep on washing hands with water and soap. Avoid touching the face, nose, mouth and eyes. Follow hygienic habits when coughing and sneezing. Adhere strictly to social distancing instructions. Stay at home and not to go out unless absolutely necessary. Adhering to isolation and social distancing will prevent you, your family and the community from COVID-19. Stay safe.
The Royal Oman Police announced that all control points between the governorates in the Sultanate were halted except for the governorates of Muscat and the Wilaya of Matra. The ROP stated that all control points were terminated this morning, Wednesday. However, the lockdown in the Muscat governorate, the Wilaya of Matra and the Wilaya of Ja'lan Bani Bu Ali will continue. The central market for vegetables and fruits resumed the retail sales to consumers amid precautionary health measures. The market's administration stressed that trucks carrying local and foreign agricultural products are continuing to supply the market on regular daily basis. It added that there is abundance in supply and stability in prices. At this pandemic crisis, healthcare staff are working day and night providing quality health care. More details in the following report by Abdullah bin Ahmed Al-Rubai.
Healthcare institutions at different levels play a critical role with the health system in providing essential health care to the community, particularly during a crisis such as current pandemic, as combined outbreak can lead to the progressive of the disease. So, to enhance readiness of these healthcare facilities, relevant generic priority action were taken where a number of routine cases reduced, while patients' monthly prescription is sent to their homes. At the same time, general and specialized treatment services is continuously available and is being provided to all those whose condition require urgent attention.
Bosher Polyclinic function as a specialty clinic in the morning time, and it is functioning as a general practice in the evening time. We want to reassure people that you will be offered the urgent services if required through our regular appointment. So you always can wait for our calls. We will make sure your monthly medication will reach you either by collecting it yourself or it can be delivered. All safety measures are well considered in our polyclinic. People who are coming or they are requiring a general practice or general services they will be filtered through special guidelines, and they will be always given a special care. And I can reassure people that we have a thermal camera in the polyclinic where it can always detect any fever earlier and to be directing the patient to the right place.
On their arrival to the healthcare institutions, they undergo necessary precautionary procedures for detecting the infected patients. As seen at the entrance of this healthcare institution, the screening desk is facilitated with temperature detection camera that measures temperature by scanning people's faces using state-of-art sensor technology. There is a distance displayed here between staff and patient, and filtering takes place. For those suspected with COVID-19 are then directed to the isolation room for throat swab collection, and necessary action is taken accordingly. Healthcare staff, too, observe the prevention measures by following guidelines issued by the Minister of Health on COVID-19.
At this time of pandemic, the healthcare team are well united. There is an extraordinary coordination from nurses with other healthcare staff to deal with this current situation. Thank God. Alhamdulillah.
Healthcare workers are working day and night throughout the Sultanate, providing quality health care while sacrificing their health in the battle to combat COVID-19.
Together we can beat the coronavirus. Just stay at home and be safe.
Your safety is very important to us. Please stay home.
Abdullah bin Ahmed al-Rubai, Sultanate of Oman Television, Muscat.
Still to come in our news bulletin. A digital artificial respiratory device is developed by Oman Makers Center, which is approved for usage in Sultan's hospitals.
Non-compliance with the directives of the Supreme Committee dealing with coronavirus COVID-19 exposes you to risk and legal action. Stay safe.
Welcome back to the news from the Sultanate of Oman Television. The agriculture and fisheries wealth sector achieved a growth by 7.4% in the gross domestic product for the year 2019 compared to 2018. It was sorted among the highest in the economic sectors in the Sultanate, where the value of agriculture and fish production reached 964 million Omani riyals in 2019. The Sultan's self-efficiency of fish during 2018 reached 170%, followed by dates by 99% and vegetables by 78%. Oman Air continues operating flights to provide basic commodities and foodstuffs to the Sultan's market, as well as to support the inventory strategy of the commodities. During April, it operated 8 unscheduled cargo flights, 5 of which were to India, including 3 flights to Mumbai city and 2 flights to Kochi. The 3 other flights were to Guangzhou city in China, with the aim to provide medical items and equipment to the Ministry of Health and the Royal Oman Police, as well as other bodies. Oman Makers Center has developed a digital artificial respiratory device by simulating a ventilation system approved in the Sultan's government hospitals. Here's a report.
Oman Makers Center, based at Muscat Innovation Complex of the Research Council, has developed a digital artificial respiration device by simulating a ventilation system approved in the Sultanate's government hospitals.
Due to the lack of ventilators around the world, we in Makers Oman wanted to calibrate to innovate an electronic ventilator after simulating certified ventilators.
The new system was developed after seeking the advice of specialists in the health sector, including engineers and doctors. It simulates all the details and configuration of the existing system. The model has been subjected to additional tests over the past weeks to ensure its smooth functioning prior to the start of production of similar systems. Engineer Suleiman Al-Sakri of Oman Makers Center said that the initiative comes in conjunction with national efforts to contain the impacts of coronavirus COVID-19 pandemic. It seeks to contribute to addressing the common concern through the utilization of the albeit limited knowledge, innovations and capabilities of the center to cover shortage if matters escalate. The system differs in its design for the manual system through the addition of globally approved modernizations in terms of quality and efficiency of performance. Oman Makers Center put safety on top of its priorities, hoping that the new system will be a precursor in the growth of a local culture of innovation to be exposed by nation cadres in addressing challenges. The prototype proved to be a success as a practical, safe and reliable device.
Oman oil price June delivery increased by $3.33, amounting to $20.15 per barrel. The average price of Oman oil May delivery reached $34.85 for the barrel, decreasing by $19.77 compared to the price of April delivery. Here are the Ramadan times for tomorrow. Fajr prayers will be at 4:15 a.m. and Maghrib prayers will be at 6:39 p.m. This is the Sultanate of Oman television. Before we end tonight's bulletin, here are the main points once again. The Ministry of Finance directs government companies to speed up replacing expatriate workers with Omani citizens in various job levels. The Ministry of Health announces 143 new confirmed cases of COVID-19 in the Sultanate. All control points between the governorates in the Sultanate are halted except for the governorate of Muscat and the Wilaya of Matrah. And the central market for vegetables and fruits resumes retail sales to consumers amid precautionary health measures. With that, we come to the end of tonight's news bulletin. From all of us here at the studios and the newsroom, it's good night.
فيروس كورونا المستجد كوفيد-19 يجتاح العالم. لم يترك قارة إلا وأصابها وآلمها، وهدف هذا الوباء العالمي جهازك التنفسي. أنت الوحيد القادر على إيقافه. هذا الأسبوع هو أسبوع حرج جدا. ابقى في المنزل وابتعد عن الاختلاط نهائيا. أوقف انتشار المرض وأنقذ أرواح من حولك. مع تحيات الجمعية العمانية للسينما والمسرح.
الكمامات عدة أنواع، وهذا النوع أشهرها وأكثرها استخداما. وأما القناع التنفسي المسمى N95 يستخدم للطاقم الصحي فقط، ولا ينصح بأن يرتدي الأصحاء الكمامات الطبية، وينصح بارتدائها فقط مثل بعض